My name's David Ginsberg. I'm a urologist at the Keck School of Medicine at USC. I take care of a lot of patients with neurogenic bladder, which means I take care of a lot of patients with multiple sclerosis. Now you may be wondering, I'm a urologist, which means I take care of bladder problems. But the title of this lecture is bowel problems. And the reality is when you have bladder problems, you often have bowel problems. And in the reality, I didn't really sign up as a urologist to take care of bowel problems, but we are commonly doing it because they go together. And it's important for you all because with MS, not only do you often have bladder problems, you often have bowel problems as well. So if you look at this slide, we know that MS can occur at a variety of levels and lesions, and that often results in bowel problems. And bowel problems are common in MS, up to almost 70% of patients. And when you ask, well, what do you mean by bowel problems? Well, it could be constipation. It could be fecal incontinence, involuntary bowel movements. It could be diarrhea. It could be incontinence of not only stool, but incontinence of gas. So these are all things that we work on. And one of the reasons it's common, the slide really speaks to this, besides the fact that there's a neurologic issue that can impact the nerves responsible for how the bowel works, which is common, limited physical activity, which we see with MS, does not help things. There are medications that often you may have to take, and those side effects may be negatively impacting your bowels. You may not drink enough water, and that's often related to my world in the bladder, because if you have urgency and frequency, sometimes the response is, well, I don't want to go to the bathroom to empty my bladder that often. I'm going to drink less fluid. And then you get in this vicious cycle because you drink less fluid, it makes your bowels work. And when it makes your bowels worse, then that actually impacts your bladder. And this is just a slide of what happens. You get a backup of stool, and you have these problems leading to constipation and other bowel problems. So what are treatments? We're going to talk a little bit about treatments very briefly, but I want you to understand what's out there, whether it's lifestyle, medications like stool softeners, there are other bowel therapies we have. What we want to do is get you on what we call a bowel program that really helps get your bowels working on a regular basis, preferably on a daily basis, but unfortunately that's not always the case. So what are some tips? So diet. Diet is an important role, right? Eating regularly for your bowel habits, drinking enough fluids are helpful. And the whole idea is to have a plan and maybe think about having a bowel movement, half hour to an hour. It was called peristaltic activity, which really is what moves the stool through the large intestine. And that is at its highest activity soon after you've had a meal. So that may be the time. So think about getting in a routine to optimize your bowels. Nutrition is really, really important, and really optimizing the diet. Exercise we know can be helpful, but again, if you're going to exercise, you might get sweaty, you might get dehydrated. You got to keep the fluid intake up as well. We talk about keeping journals or really keeping a log, a diary to understand what food or your fluid intake that may help move your bowels along, because that's important because you really want to be able to duplicate that. So it's bowel training, it's diet. So, when we talk about diet, what does that mean? Now, I really think that fruits and vegetables are important. And certainly all of our doctors, my doctor tells me the importance of fruit and vegetables just because it's healthy, but also promotes healthy bowels and healthy diet. I'm certainly a big believer in stewed fruit and prunes for patients, and that also can be helpful to move the bowels. And then it's medications that help move things, and it's bulkers and laxatives. Those are all helpful. So that's very general view, but really, I'm a urologist and I take care of the bladder, but if we can optimize your bowel, not only will you be happier for that, but often can impact your bladder dysfunction in a positive way as well. So thank you so much for listening, and hope you have a great day.